About a month ago, we saw some preliminary data at the state that was shocking to, I think, all of us, even though we knew there are different barriers, different opportunities in different communities. While we're showing that statewide, more than 75%, 3 out of 4 of older adults 65 and over have gotten a vaccine, the rates vary across race and ethnicities and across communities. So at our preliminary state data look about a month ago, the number that most jumped out to me was the vaccination rate for Latinos 60 and over was around 40%. Half of what the state is tracking for white and Asian American elders, and strikingly lower than Latinos in their 50s, which is the only racial group where we see 60s lower than 50s. And then of course, 70s and 80s is even lower than 60s, when we know that those are even higher risk of the worst outcome from COVID, of course, losing your life. So what are we doing about it? We're gathering here today. We've done a couple things. I think first, we have tried to make it easier logistically to get to the vaccine, push out from these mega sites to community sites, offer free transportation, offer phone lines, not just online sign up, offer drop-in without appointment. So we're trying to make it easier and getting the word out that it's easier than ever to find a vaccine as part of our message.
It's not just that the older you are and which community and what part of the state you live in that makes a difference. It actually turns out that healthier older people are more likely to get vaccinated than less healthy older people, even though the less healthy people are the people most likely to get serious illness, to require hospitalization, and to die. So in this pandemic, for instance, about 4% of American old people live in facilities, nursing homes, assisted living facilities, but they accounted for, across the country, 34% of deaths. Now, you might say they are the oldest and the frailest, but what is also true is that in many states, they took old people who lived in the community who got COVID. Most old people, 96% of old people live in our communities. Those people got sick, and they were so sick that they couldn't go home. So what did they do? They sent them to nursing homes and assisted living facilities with their COVID. So they took people with COVID and put them in the facilities with the people at highest risk. At the same time, they did not provide those facilities with the ability to test or with the equipment to protect the people who worked and lived there. That also meant that the sort of people who work in those facilities took the disease back to their communities, usually low-income communities of color. So what can you all do? Make sure you have accurate information. We've also had some trouble collecting information. Maybe within your communities, you could help to collect stories. That enables the government to put more resources. They put resources in places where there's noise, where there's action, where there's need. And this is a population that by definition doesn't make too much noise. So think about answering people's questions. What are their concerns? I've heard from patients different things, such as they're going to put a chip in me that's going to track my every movement, which if you come from certain countries, well, I think if you come from any country, you're not going to want that, but from certain countries, you'll be more worried. A lot of my patients who have illnesses think that's a reason not to get the vaccine. Whereas in fact, the opposite is true. And if you can get that one message across, that would be a huge help. The older you are, the more medical problems you have, if you are disabled, these are the 3 best reasons to get a vaccination.
So back in about December, January, when vaccines were starting to be available, we already came, just like you said, we knew then that the limited English speaking, the monolingual, the immigrant and the low income communities where our seniors really reside could not navigate that appointment system, right? I remember a lot of the grandchildren were hovering over their computer for 6 to 8 hours in order to get 2 appointments for their grandparents. So if you are a senior and that have nobody, to do that for you, you're at the mercy waiting for something to happen. So starting in April, we start to hear that there's a zip code in Chinatown, San Francisco, Chinatown, that has the lowest vaccination rate, and this is 94133. We work together as a team to make visits to the SRO buildings, right? The single hotel rooms with congregate housing. And we're just very fortunate that there's no major outbreaks in Chinatown. We have been doing that, and the 1,000 people in this one zip code about 6 weeks ago that were identified through intensive phone calling, making visits to these buildings, canvassing. And I think that by now, most of the people have been vaccinated, except the last 20% that just, no matter what you say, they're just very obstinate and kind of stubborn about it. But we're not giving up on them.
This slide illustrates the widely divergent views among older Blacks about the vaccine during the course of our interviewing. If you look at the rejectors on the left-hand side, this is a group, and a small group, of older Black adults who see medical abuses going back to slave ships as cautionary tales. On the right-hand side, the believers are completely different. They see a link between the past and the present as problematic and believe in the science, and the COVID-19 vaccine is safe for them. The important group on here, well, they're all of course important, but an important group to understand is the wait and see. They are somewhat like the rejectors in that they have some concerns, see a connective tissue between what happened in the past and now, but their primary concern is more about side effects and concerns about reactions to medications, et cetera. During the course of the interviewing, which took place from January through April, we did recontact interviews with people who were wait and see, and we learned that most of them had since gotten the vaccine. Why did they move to the right? Not because they believe in the science overnight, they're not overnight believers, but for pragmatic reasons. Access is huge. One man talked about the vaccine being available in the lobby of his building, and that changed his mind from being hesitant to getting it. Some have seen their doctors, which play an incredible role in helping older adults make a good decision for themselves, but they weren't necessarily seeing their doctors during the pandemic. They have seen friends and family who in their age cohort have gotten the vaccine and haven't grown a third limb or had other side effects. And certainly as an older person, they realize that they are more vulnerable and they don't want to die.
The COVID pandemic is the most horrific manifestation of ableism and ageism that I think most of us have ever seen in our lifetimes. We've seen this crisis in nursing facilities, in other facilities for people with disabilities. We don't even know the toll. Older people and disabled people who rely on home attendants or family caregivers put themselves at risk of COVID every day that people came in and out of their homes. And I don't remember ever seeing this talked about widely. Then we dealt with the threat of care rationing. This idea that hospitals were so worried that they wouldn't have enough ventilators or enough ICU beds that they would have to decide who to treat. And very early on, it became clear that they were assuming that older people and people with disabilities would be low on the priority list. And they say this is about survival rates, but that's only part of it. I think we know, and we need to not sugarcoat the fact that this is about whose lives do we value, that seniors and people with disabilities are seen as less important and more expendable. There was a story that came out in Texas of a man named Michael Hickson, who was a Black disabled man. And he died of COVID, and he didn't need to. He was in the hospital, and a doctor suggested that they remove the ventilator because the doctor said he didn't have any quality of life because of his disability. This was a judgment call by a doctor, and many studies have shown that health professionals assume that disabled people have a lower quality of life than the disabled people themselves believe that they have. And it's no coincidence that the man was disabled and Black, right? Two factors that led to a white male doctor, non-disabled doctor, making this judgment value about his life.